So again, thank you everyone for joining us. My name is Jane Dimolby. I'm an attorney and Equal Justice Works Fellow at Tennessee Justice Center. And our organization has been bringing you all Wednesday briefings where we talk about the impacts of the proposed of the budget reconciliation bill and the proposed changes on Medicaid and SNAP. Today you'll be hearing from me, from Gordon, and from Signe on the impacts to Medicaid and SNAP separately, but also the overall impacts the public benefits safety net, which is a lot of our work here at TJC. So just some logistics. This meeting is recorded, so you'll have access to it if you registered for this call. We also want to keep this conversational. We're going to spend today hearing from Gordon and Signe about any updates that we've learned about the process. But afterwards, we'll follow up with some notes that you all can have about the details covered today. So the conversation is about finances, it's about data, it's about really intricate policy changes. So listen to us today and have a conversation with us, but surely you'll have the information to review at your own pace. I also wanted to emphasize the conversational element of today's call. So we have Signe with us and Gordon. They'll be kind of bouncing off of each other, but we want to hear from you. So if you hear something that you want to chime in on, please use the raise your hand feature or use the chat to let us know. We'll unmute you and let you speak. So Gordon and Signe, I'll give you both a minute to introduce yourself. And Signe, please let the folks know where you're joining from. I think they'd love to know that. And yeah, let's get started. Gordon.
Thanks, Jane. Hi, I'm Gordon Barnum, I'm a staff attorney at TJC, and I work mostly in the Medicaid space.
Hey everyone, Signe Anderson. I'm the Senior Director of Nutrition Advocacy at TJC, and I am joining you all from Knoxville. So for those of you in Knoxville, I'm here in your town. We're here for about an hour, and then we're headed off to Kingsport for an anti-hunger conference tomorrow. So on the road, if you have any problems hearing me, let me know. But I think the connection is good.
It is fantastic, Signe. Thank you so much for joining us while you're mobile. So I'm going to start off giving everybody an overview of the budget reconciliation process as it has occurred and what to look ahead, what you'll see looking ahead, not quite looking forward to. Just to review, right now Congress is using the budget reconciliation process to create a mega bill, which you will often hear referred to as the one big beautiful bill. It's cutting taxes and incorporating the president's policy agenda, and it is essentially a way to fast track cuts and limit amendments, and it prevents a filibuster from occurring to slow down the bill. So far we've seen the bill go through the House of Representatives, and it's now in the Senate where it's being debated and amended. The House and the Senate set a self-imposed deadline to have the final bill passed by July 4th, which is coming up fairly soon. So we spent a lot of May beating the drum about the discussions in the House, and now we've moved on to talking about and trying to prevent any disastrous changes in the Senate. So still the same conversation, just in a different forum. And the House bill actually passed on May 22nd. So you might remember one of our calls around that time. We were talking about some of the challenges to getting the bill passed because due to advocacy or conversations from organizations like TJC around the country, it's become a very difficult, it had become a difficult bill to pass, and in fact, only passed by one vote. So this is important because we know that when we push these conversations around the public benefit system and the potential harms that will come from the proposed budget cuts of up to $1 trillion, our senators, our representatives get a little shaky, and it makes it hard for them to defend making some of those cuts. So that's to say that's what happened in the House, and now that we're in the Senate, we're essentially keeping the same playbook, and we want to keep talking about how disastrous these cuts are and make it clear to everyone that it's a bad idea. So a little bit more about the bill. The Senate bill is supposed to be on the floor for a vote around June 23rd. That's just around 2 weeks away. But if there are any delays in the finalization of the committee amendments, that date, that rough date might get pushed further. So again, just going back to what I was saying earlier, our goal is to create conversations that show the impacts, the disastrous impacts of the bill, and really make sure that there aren't, that if there is a vote, it is with the full understanding of the harms that this bill could pose. So we know that the Senate committees are revising the bill in secret, and what this means is some of the proposed changes have not been released. So when we're talking to you all about what we anticipate will happen, it's because there in some cases it's hard to say because we don't have exactly the proposed changes. So we have some leaks, and there's a little bit of gossip as to what might happen, what's happening in the Senate and what might happen in the Senate's version of the bill. But until that information is released clearly, it's hard to say. So we're really having conversations to keep us up to date in multiple possibilities, because we can't say for sure what's happening. So we know that this bill affects a number of issues, from energy to the public benefits system, like we're going to talk about today. But it is really, really disastrous for the programs that we'll highlight here. And we've noticed that the budget cuts for Medicaid and SNAP are the largest that are included in the bill. So this is a very, very tight, it's going to be a very tight vote again in the Senate. We know that Senate Majority Leader John Thune can't afford to lose more than 3 Republican votes. So they really have to get all on the same page about what the proposed changes will be. And what this means for us is we need to make sure that our representatives know that the states and the people that they claim to represent will be harmed by this bill, and maybe they won't be those votes that are needed. And last but not least, just going back to the congressional timetable, if the Senate version of the bill is too different from the House version of the bill, it may not be able to pass, because then the House won't approve it when it goes back. So we have a little bit of ping pong here, and we have actually power in that distinction. So if we're able to if we see a significant difference in the Senate bill compared to what was in the House, that might kind of start the process over. So we know that Trump has thrown strong support behind the current bill. He's pressuring members of the House and Senate to pass it quickly, but that doesn't mean that our conversation should stop. We should keep pushing the narrative and the reality that these will be disastrous for our states. So, and I'll just say finally, the urgency to pass the mega bill quickly is driven by several factors. Inside and outside of the control of the White House. And Congress has to raise the debt ceiling by the end of July to prevent a default. And that has brought a lot of attention to the mega bill and to the proposed cuts here. So next year, all the House members and a third of the senators are facing midterm elections. And so they are also reputationally concerned, and that kind of adds to some of the tension around these negotiations. So all of this to say, it's been very busy in DC, and that's made it very busy for us. So we really appreciate you all coming to these conversations every week, because it kind of allows us to step away from the headlines and focus on what actually might happen here in Tennessee. So if you have any questions about the overview of what's going on in Congress, the ins and outs of the House versus the Senate, and the negotiations and the amendments, put them in the chat and we'll talk through them. But for now, I'm going to turn it over to Gordon and Signe to tease out some of the proposed changes as we know them right now here in Tennessee. I'm going to throw it to Gordon first to talk about health, and I look forward to hearing what he has to say. Thank you, Gordon.
Thank you, Jane, and thanks everybody for joining us and for all that you've been doing to try to influence the outcome of this titanic struggle. And it is titanic and unprecedented. Those are terms that get worn out a lot these days, but it's true in describing the mega bill. All we have to work with, we now have the final fiscal note analysis that was done by the nonpartisan Congressional Budget Office. I think last week we had just gotten it. We hadn't had a chance to go through it. It was released like an hour before our conversation last week. It really confirms the big picture, which is 7.8 million people would lose Medicaid under the bill, and 3.2 million would become uninsured as a result of loss of insurance through the marketplace. So we're talking about affecting 11 million people who will become uninsured under this bill. That, although there's been discussion at the congressional level and coming from the White House that this is only about fraud, waste, and abuse, it is actually about taking away healthcare from across the spectrum. As CBO pointed out, these reductions are not just limited to certain demographic groups. They cut across. They will affect children. They will affect seniors in nursing homes. They will affect people with disabilities. They will affect working people. So it's really just taking away health care. The size of another way of trying to measure this is terms of dollars. CBO has confirmed that it will take $1 trillion with a T out of Medicaid over the next decade. And there had previously been discussion of 880 billion, but that is now up to $1 trillion. And that's not all, because other analyses that from think tanks that have worked off of the CBO analysis have concluded that there'll probably be another 300 billion in state funding that will come out of the program. As I think we've discussed in the past, Medicaid is a joint state federal program in which the state puts up its matching share, which in Tennessee, it varies by state. In Tennessee, it's about 1/3 of the cost of benefits, and then the feds match that. So if you take away the federal money at the level that we're talking about, which again is $1 trillion for the nation over the next decade, the estimate is that that will pull, because the matching dynamics, will pull another 300 billion in state funds. So we're really looking at 1.3 trillion with a T cuts in Medicaid, which is really difficult to contemplate. It's so horrific. There has been a bunch of pushing and shoving within the Senate Republican caucus, and some toing and froing between the Senate and the House. It's all been behind the scenes, as Jane was explaining. There has been leaks, there's been gossip. And I think Signe probably has some more definite gossip, if that can qualify, if that's not an oxymoron, but about SNAP. But in the case of Medicaid, we haven't heard a lot about what could change. What we've heard is that there's been pushing to make the cuts deeper because of the outcry over the CBO fiscal note that it will add $2.4 trillion to the debt. And Elon Musk's condemnation of the bill as an abomination because of the deficit that it would create. So since the Republicans in Congress and President Trump don't want to dial back the tax cuts that are fueling that deficit number, they're looking for additional cuts to make up for the lost revenues from reducing taxes. And so Willie Sutton, the bank robber, famously said he robbed banks because that's where they keep the money. And Medicaid is where they keep the money, Medicaid and SNAP, but particularly Medicaid. So there was even the desperation to try to trim the deficit without touching the tax cuts was reflected in a brief conversation within the past few days of possibly even cutting Medicare, which is widely regarded as sacrosanct and a third rail of politics that you don't mess with it. But the Republicans were so anxious to try to get the deficit number down that they were talking about that. The latest is that they've stepped back from that. And one of the reasons why Medicaid and SNAP are so vulnerable is because Medicare has been off the table. So that's also a bank where they keep the money. But if that bank can't be uh, tapped for savings, and actually some of the savings that were proposed for Medicare would not have been cuts to the program, but would have actually, by some reckonings, um, created greater accountability and less profiteering by some of the managed care organizations in the Medicare Advantage plan. But that's gone by the board. So we're now looking at increased pressure on Medicaid. We don't know how that's going to play out. So I'm afraid I'm mostly sharing ignorance at this point of where things are rather than hard information. But Signe, can you shed some light on where things are? I understand that there may be some changes with regard to the state sharing. At least
Yeah,
that's the rumor.
that's the rumor. Yeah, those are the latest updates. The House reconciliation bill, last week when we talked, we were really concerned that the Senate was going to run with that, and they're still not deviating much from what the House bill proposed. But last night there were some reports out of the Senate as they're finalizing a scaled back version, specifically to the SNAP cuts, after backlash from some Republican senators, and then also they've heard from you, from all of us, and so I think the public outcry has been enough that that's helped a little bit. Um, but just to recap, some of the major proposed cuts to SNAP are through work requirements, really now expanding work requirements to families with children, cutting SNAP education funding, and then the really big piece that they've been looking at is the state cost share. States in the past have not been responsible for footing the bill of the benefit that the family receives. That's always come from the federal government. So that those are our tax dollars at work coming back to the state. And that's always been 100% federally funded. And the House version had said, depending on the state's error rate, they would require states to pay up to 25% of the budget, and that's huge. That's a huge cost for Tennessee if that is the direction that they decide to go on. The rumor last night was that they're trying to scale that back. They're not trying to get rid of it, and that's what we want. We want them to get rid of that, but they are scaling it back to saying that the most they would ask states to be responsible for is up to 15% of the benefit. Better, but still bad. And then they were also talking about waiving some states from being responsible for this altogether. And honestly, a lot of the states in the South would be likely responsible for higher state cost share because of some of the error rates. For those of us who've been following along on what's been going on with DHS and the issues with SNAP, their error rate has been high, so we would likely see that higher responsibility for the state to pay for benefits. So that's kind of the latest. They're headed in the right direction, but still not good enough. We do not want any cuts, and we do not want a cost share like that for states. The other part of the cost share is the administrative cost. States have always paid part of the administrative cost of the program. We've always paid 50% of the cost to operate SNAP. They're not looking to change the House version. The House version is going to increase that from 50% to 75%. So the state would be responsible now for the majority of the administrative cost of the program, and that the Senate seems to be holding true to the House bill. So the only real change we've seen is to address the cost share and make it less, not eliminate it. We want it eliminated. but those are kind of the late break, the latest breaking news that's coming out from last night. And I think I'll pause there to see if folks have questions, and if anybody else
Can I
has any
just,
comments to add. Yeah, go ahead, Gordon.
can I just add to that, just a minor correction, maybe not minor, it's not the latest breaking news, it's the latest breaking rumors, right?
Right.
We don't try to take the change to the bank yet.
Latest breaking rumor that's in the news.
Right, okay. And I did some quick math using a calculator because I'm a lawyer, because I don't do math, but I used a calculator and had previously, using the data we have about current state use of SNAPs and the value of those benefits, and the administrative costs. The administrative changes would add $77 million to the state budget. If they keep the 25% share of the cost of the benefits themselves, that would be 483 million. If they would dial it back to 15%, we would still be out upwards of 300 million. So we're close to that. So we're looking at a hit to the state budget, a minimum of 158 million and possibly as much as 300 million. If the latest rumors prove true, and it would be closer to $500 million if the House version becomes law. I'm dwelling on these numbers because at some point it no longer is just about SNAP. It's no longer about Medicaid. It's about everything that's touched by the state budget. And that definitely means education, because again, Willie Sutton principle, where do you go to get savings? You go to places in the budget, in the bank, where they keep the money. And the largest expenditures in the state budget by far are for K through 12 and post-secondary education. And the Medicaid cuts that we're looking at now, I said the national figure was 1.3 trillion. The state figure would be 1.5 billion. So you add this together, you're beginning to push towards a couple of $1 billion, and potentially in the House version, and that would be really disastrous across the board at the state level. Hate to be a
Yeah.
Debbie Downer, or a Don Downer,
That's
but
okay.
here we go.
Everyone knew what they were signing up for when they came to this call. This is for us to get informed, and then we'll leave empowered. So it's gonna be okay. But to that end, Gordon and Signe have just highlighted that what happens in the federal at the federal level, how what happens at the federal level will significantly impact folks in Tennessee, especially our state budget, and putting more pressure on it where it might already be constrained. And I noticed that we have folks from various organizations here, so I'm sure you all have thoughts on what the consequences might be of a more constrained state budget. So I was hoping we could use the next portion of the call to hear from you all. How have your advocacy strategies been successful to raise awareness around these budget cuts, and about the needs of Tennesseans and the people who might be harmed by some of these changes? We really want to hear about your advocacy strategies, whether you're hosting calls, or sharing informative publications, or having your own webinars like we are doing. So I hope we can spend a portion of this call from hearing from you all about your advocacy strategies, because we really want to know what's working for you, and how we can incorporate all of that. So I'll pause here and see if anyone wants to chime in and talk about what their organization has been doing, and we can just maybe have a discussion at that point.
And I just want to call attention to Tony Gar's note in the chat, noting that KFF estimates that 180,000 to 300,000 Tennesseans will lose their health insurance from TennCare and marketplace coverage over the next 10 years. And Tony includes a link to the KFF source for that information. KFF is the website formerly known as Kaiser Family Foundation. They are sort of the gold standard for health nonpartisan health policy analysis and data. So thank you very much, Tony.
I also wanted to lift up Jamie's comment. Jamie Gutierrez in the chat mentioned the increased demand on many of our food assistance partners, like the YMCA and our food bank partners. If we haven't said this in past calls, I'll say it now. I think we have, but just this is an important statistic to repeat. For every one meal that our food banks provide in assistance to families, SNAP provides 9. So if you take away SNAP, that becomes an incredible burden on our emergency assistance partners who are already strapped thin and are already facing threats and cuts to their programming as well. So that's something to keep in mind. And Jamie, we can see if we can drum up some other numbers for you as well that speak to what the impact is for our partners who have to step in when SNAP gets threatened or would be cut.
Yeah, just on that point, I read a quote from the head of the Houston Food Bank who'd done the math and said cutting SNAP by 11% would be the equivalent of wiping out every food bank in the US. And they're talking about cutting it by substantially more than that in many states.
Thanks, Joe. I'm leaving the floor open for some folks to chime in about advocacy strategies, because that's really what we want the bulk of this call to be. We spent a lot of time sharing information, but we would love to hear from you, because that would be very educational for us and hopefully inform how we talk about these issues moving forward. So I see Tony.
Tony Gar. I just put a flyer in the chat where you can download it, I think, about No King's Day that's happening this Saturday in Nashville, of course, but there's 21 different activities across the state in Tennessee this Saturday, as far as different locations from Tri-Cities to Memphis. So the one that is in the chat is specifically for Davidson County, in the sense that it has the DC number for Marshall, Blackburn, and Haggerty. Now, let me explain to you why I would be putting phone numbers out there for people who are very active and engaged. In my years of experience, we got to make it easy, accessible, and so where they can call right away, and they will have these numbers in front of them. It's going to be printed on a colored piece of paper so they can remember what they received. And I'm going to be distributing these on Saturday. So, I would love to see 5,000 people at the gathering on Saturday here in Nashville, and I'd like to see that in Knoxville and other cities. Of course, I'm interested in healthcare, but the SNAP program is just as important.
Thank you,
Thank you
Tony.
very much.
I think as a strategic matter, and I hesitate ever to differ with Tony, particularly on an issue of health advocacy and justice, but I think it's important to separate advocacy directed at the delegation and the public about Medicaid and SNAP from other criticisms of the Trump administration or the Congress, which will be perceived as partisan. This has nothing to do with my personal sympathies. It's just, if we want to try to move the delegation and we want to try to appeal to the public in a red state, the more we can focus on the impact on people's ability to get health care and food, and the need to protect these programs, the better, and separately make our voices heard if we feel moved to do so about other troubling policies that concern us. So I just want to make that point.
Hi,
So-
Janet, I see you have a hand up. Go ahead.
Did you call on me, Janet?
I-
This is not from my organization. This is from me personally, but there's an app called 5Calls. And you can download it. You plug in your address. It gives you who your elected US representative is, who your 2 senators are, gives you their phone number. And they have a whole list of issues that are currently of concern, including the cuts to Medicaid and SNAP. And they give you a little brief background about that, so you'll feel more knowledgeable about what you're speaking of. Although those of us on this call are going to be pretty knowledgeable about Medicaid and SNAP. But, and then it gives you about a 3-sentence script. So you can punch the phone number, call them, and then read the script. If you don't feel confident arguing on your own or advocating on your own, this short script will give you, and it meets the time limits of their voicemails. So it's a quick and easy way, and I would encourage you to have their phone numbers in your contact list on your phone. That's an easy way to call. But anyway, I just wanted to share the 5Calls app. I've found it very useful. I'm trying to call at least 3 days a week to tell them. Sometimes I intersperse it with other concerns. As Gordon said, there are lots of things to be concerned about, but I try to make at least 2 calls a week about SNAP and Medicaid. So thank you.
That's great, Janet. And for folks who had not heard about 5Calls, I'm putting a link to it in the chat, and then you can find it on your phone. And I think, Janet, that's a great point. Sometimes folks can't speak on behalf of their organization, but if you're able to speak about what you're doing as an individual, we would love to hear that too. So please feel free.
Jane, I'm happy to jump in. I was trying to find the hand to raise and couldn't find it, but I just want to express my appreciation to TJC again for you all holding these webinars and keeping us informed. From our perspective, Age Well Middle Tennessee, in our work with the Tennessee Coalition for Better Aging, we're trying to keep our membership aware and just continue to post on LinkedIn and encourage people to make phone calls and point out in particular the impact on older adults and family caregivers. Someone shared with me yesterday a brief that from the Center on Budget and Policy Priorities that's specific to how the House bill will impact older adults, and that's very helpful. But Gordon, thank you for breaking down the numbers for Tennessee so that we have those at our fingertips as we make these phone calls. One question I have is, to Gordon and Signe, is it more effective to make calls or to send emails? Does it matter? Is one strategy better than the other? Because I'm finding again and again, it's about leaving voicemails if you do make the calls.
Signe, do you want to field that? Or I would throw that to we have people like Tony. We have, I don't know who all is on the call. Certainly Tony is a veteran at this. If others have insights on that, my personal impression is that if you call the staff in your local office, we're talking about the senators as well as the House members, if you call their local office, you're more likely to get through and you're more likely to actually be heard. And so I think a call, it's a numbers game. We know they're counting, but we also think that probably the staff are reporting back some texture and nuance, and the more details we can leave with people about the reason why we're concerned, the more impactful it makes.
Tanae, please.
So just to add to Gordon's response for that question, we've heard from the staffers directly that they are looking to understand the impact of the cuts. So as you call or email, if you can convey the impact to your community, to the area or that you represent, those details really are what the staffers are looking for to be able to sort of translate the numbers into the impact that's going to hurt individuals. And so going along with that, if there are stories that can be lifted up by you all or by those that you serve or by your family members, sharing the impact is really what the staffers are looking for. Thank you, Jane.
And one thing I'd 100% agree with Tanae, like the stories matter and make a huge difference. The other thing that I would say in support of what Gordon was saying, it is numbers. Like they're going to record everything that comes through, whether it's email or voicemail. And if you can get a staffer on the phone and have a connection with them, that's great. But the other thing I would say, like if you can't call until after 5, call anyway. You can call and leave a message. That's important too. And if you're just like starting out at this and you're new to this, sometimes you might feel more comfortable calling and leaving a message the first time. So all that to say, like call anytime. But if you have a good story, call before 5 when you can connect with somebody and talk it through with them. But don't not call if you see that it's after 5.
And beg, badger, plead, bully, browbeat, beg, anybody you know to make calls as well.
And just know
Yeah.
that you're seldom going to get pushback from staffers. They will generally just thank you for calling. It's an occasional time that I've had somebody say, well, that's not right. But generally speaking, they'll just accept what you've said and say they'll let the senator or the representative know. So it's not like you've got to have arguments ready to fight with somebody.
Yeah,
If I
just want to
could
emphasize the chain reaction element that everyone's kind of talked about. If you do something, get other people to do it, it's really, really powerful. And Gord, just before you get into some substance, another logistics point, there is a poll right now that everyone should have seen pop up that asks you how you are engaging with regards to advocacy strategies. So if you could please use it to let us know what you're doing, whether it's social media, emails, calls, or if you went that extra mile and wrote an op-ed in your local newspaper. We just kind of want to see what you all have been able to accomplish so far. Okay, that's it, Gordon.
Well, I was just wanting to follow up on Grace's point about the impact on older Tennesseans. We've talked so much about the budget impact, but it's important to know that the One Big Beautiful Bill has a whole bunch of other things in it that are harmful apart from the cuts. And a perfect example is doing away with staffing requirements for nursing homes. Advocates for nursing home reform have been lobbying forever to try to raise staffing levels. We know that inadequate staff is a huge safety and quality of care, quality of life issue for people living in nursing facilities. And this bill would abolish progress that had been made in that area. It's not so much about saving money, it's really a windfall for the nursing facility, nursing home industry. And it's really damaging to the mostly older population that relies on those services. So that's just one example of there's a lot not to like about this bill, aside from the big picture issues. So thank you, Grace, for raising that.
I'm going to take a second to talk about the poll results so far for anyone who's curious. So we asked, what advocacy strategies are you using to raise awareness around Medicaid and SNAP cuts? So 60% of you all responded that you are contacting senators directly, which is great. That is what we like to hear. That's what we've been asking you to do for the last several months. So go you and keep up the pressure. And then we have about 53% have said that they've used social media to raise awareness. And that is great because we know so much information, so much attention is on various social media pages. So if you're using your personal social media or, for example, TJC social media, we just want to applaud that. That's great. That's where we can share the most up-to-date information about what we know and how you can all get engaged. I'm gonna take a moment to plug TJC's social media. We have a very, very active Instagram page, which we use to connect with people. And we kind of keep it very simple. It's a little less in depth than these calls, but it still gets the message across, tells folks how they can take action, and keeps them up to date on the developments of the bill. We have some folks who are sending emails to their personal network, which I just want to acknowledge as a high lift. So I think that's great. I think you all are doing exactly what we've discussed and what all the national groups are recommending. So shout out to those folks who are taking the time to reach out to folks directly. And then we have folks that are doing other things. So thank you all for taking that poll and for giving us that information. That's really what we wanted to come away from this call with. We had some questions that were dropped. A few of them were answered in the chat. I'm going to leave some more minutes for folks to chime in on their advocacy strategies or things they're curious about, and then we can do a brief Q&A towards the end of the call. All right, hearing none, I might move us towards the Q&A. We have a couple of questions. But please, if you do think of something, you can come off mute and we can just adjust the conversation to discuss with you. So like I said, a couple of the questions in the chat have been either answered or responded, or someone responded. But that's all been happening in the chat. I know everyone's not tracking that. So I'm gonna just uplift a few of those for Gordon and Signe, for us to just have a conversation about and see if there's any context we can provide to folks. So we had someone ask, how likely is the June 23rd date? And that is for the Senate floor vote, that this person was hearing a later date is likely. Gordon, have you heard any noise about how likely that June 23rd date is?
I mean, it's kind of hour by hour, day by day, but I have to say, I'm worried, because, for example, as Jane was explaining, Jane was explaining at the top, they're using the budget reconciliation process, which has some limitations on what can be included in a bill and still get the fast track, no filibuster treatment. And the House version had some provisions in it, has a number of provisions that don't meet those criteria. And they just read that last night the House stripped some of those out that could have held up the Senate bill. So it's clear that, and they're doing that in a separate piece of legislation. So it's clear that the House or Senate and Senate, very much goaded by President Trump, are collaborating with each other to try to keep this thing on track. So although there's been talk of delays and there are plenty of pitfalls that could delay it, I think we have to assume that it's moving along and keeping on track. A good friend who is a staffer at the House Energy and Commerce Committee for decades, where that's the committee on the House side that has Medicaid jurisdiction, said that for both parties, the enemy is not in the House of Representatives views the enemy not as the people in the other party, but as the Senate, where their bills go to die. And so to see the two houses collaborating, the Republican leadership in both houses collaborating when they're usually not nearly so collaborative is discouraging in the current context. So I think we should assume that we're still talking about July 4th. So if you work back from July 4th, the recess starts at the end of next week, I guess it is. Or I'm sorry, 2 weeks out. And so that means they need to get it through the Senate that week, then back to the House, resolve any differences, and then get it to the president. So that's a really tight time frame. But so far they've hit the mileposts. So that's the latest.
Thanks, Gordon. We had a question, a very general question, so either of you can answer. The question is, do you think there are any potential consequences of Tennessee Republican Mark Green resigning from Congress on public opinion regarding the administration and the bill? We have a response here, just to preempt a few things. Mark Green has said that he will resign after he votes on the version of the bill that comes back to the House. So we're talking around the July 4th deadline that they're anticipating. So it's not that he's leaving right at this very moment, but do you all think that there's any reputational concerns around him leaving regarding everything we're discussing? Okay, I'm seeing head shake. Okay, so we think no, But yeah, I think it's a good thought. Maybe there's some kind of negative reception that led to it, but I'm hearing no. So we had someone in the chat ask if we had any Tennessee specific numbers for how our state would be impacted. I just wanted to highlight that on our Join Us page, which is our hub for everything to do with protecting Medicaid and SNAP, we have a fact sheet. We have actually 2 fact sheets. One is on the impact on population, and another is on the impact on the budget. So if you ever want to see who relies on TennCare right now, who might be affected, just go to our Protect Us or our Join Us page for Protect Medicaid and SNAP page, and use those fact sheets. They have the most recent data about who will be impacted, and then when we have new data releases, we do put them in our follow-up emails. So yeah, you know everything we know, and we'll share that out shortly. And I think
Again-
Signy, you answered the question. Oh, sorry. Go ahead, Gordon.
I was just going to say again to that point, and thanking Tony for providing more current. We've been using figures for losses of health coverage of 77,000 to 250,000. But the second number being if you add in the expiration of premium tax credit enhancements and so forth. But Tony helpfully put in the chat a more recent estimate by KFF of 180,000 to 300,000 Tennesseans losing their health coverage.
Thank you, Tony. Do folks have other questions about the budget reconciliation bill process so far, and or advocacy strategies that we all can take? I'm gonna leave the floor open for about a minute and then see if there are any more. All right, folks, thank you so much for engaging with us. I'm going to say some final thoughts on the call to action that we've been pushing, and give Signy and Gordon a chance to share some closing thoughts for you all for this week. So just to emphasize, all eyes are on the Senate. We are doing our best to track the discussions and the proposed changes to the House amendments right now in the Senate. And we're going to do our best to keep you up to date, as Gordon and Signy have emphasized. And our goal is to share up-to-date information in these calls. In the meantime, you'll be most effective continuing to make noise about this bill. Like we learned from our poll, a lot of you are making the calls that we're asking you to make. We're also asking you all to keep raising the profile of Medicaid and SNAP. In the time that we've started these calls till today, the profile of the proposed cuts to Medicaid and SNAP has increased significantly. And this means news coverage from national and local news sources. And that has just been our signal that, yes, taking steps to call senators and previously call representatives is important. Talking about this, talking about the change, talking about the harms to families is really, really critical. So please keep doing that, not only calling your senators, but also talking to folks about this so we bring more attention. I'm also going to highlight, we shared this in the chat, so if you just look over there for some more information, but we are really encouraging folks to write letters to the editor of your local newspaper. We just want a short civil take on the proposed cuts of Medicaid and SNAP to your community. We have some resources to help you all navigate that. And if you're interested in doing so, please reach out to us. We would love to talk about it. We would love to help. But again, it just goes to bringing more media attention to this issue. And again, when you call, get one of your friends to call too. Like I said many, many times, it makes a difference. Gordon and Signy haven't talked about this, but I'm just going to highlight one thing that we've been doing is hosting press conferences. So we have really focused on to the point of media attention, bringing coalition organizations together to talk about how these cuts could impact the disability community, for example, the medically fragile community, for example, with heart disease, lung disease, or cancer. How this can impact children, how this can impact food safety. So we're doing our part to bring coalitions together, just like we're bringing you all together, and hosting press conferences in different parts of the state that are, again, getting that media traction that we think is so important. So I wanted to just mention what our advocacy strategy is, because we are working hard, and leave you all with that. But I'll turn it over to Gordon and Signy for some closing thoughts and for anything else you all feel we should share today.
Thanks. And I just noticed that Janet Schaus put in the chat a question about, is there any benefit to contact the governor or state representatives or senators? Thank you. That's a great question. It doesn't do any harm, but I think the opportunity cost of spending your time doing that rather than getting other people to call the federal delegation, I would, again, I don't think it does any harm. At some point, that might make sense. Right now, if you have a finite amount of time to devote to it, I would try to get people to be contacting your congressional representatives at the federal level. That's just my take. Just a couple of words that we've gotten on focus groups around framing and messaging. It's very important that, I think, as I mentioned earlier, to separate our advocacy on this from anything that appears partisan. We know that the Republican members of Congress and the Senate are not going to be persuaded by talking points that sound like they're Democratic talking points, such as the fact that this will be using cost to the health and nutrition security of low income and working people to fund tax cuts for billionaires. That may be true, but it is not a helpful message when you're addressing it to Republican elected officials. They just interpret that as a partisan Democratic message. Just stay focused on, this is what will happen to healthcare and to families going hungry and children going hungry and older Tennesseans going hungry or not being able to get health care. I've often used the term safety net. The latest focus groups say that that's not a particularly good formulation. It's better to just keep talking about basic needs. This is about impairing people's ability to meet their basic needs, to get health care, to get the food they need to keep their families healthy. So just thought I'd pass those along. Keep up the great work, folks. It is making a difference, as evidenced by the rumored reductions in the amount of cost sharing that would be imposed on states for SNAP. But we have a long way to go, even in its present form. It is an enormous disaster. But keep it up. The fact that our members of the House, our two senators, will all vote for whatever the final package is, doesn't mean that calling them is unhelpful, because they do keep account. They do pass the word back to the leadership of the caucuses, and because there's such a narrow margin in both houses, that kind of intelligence and that kind of feedback influences what decisions are made about the final content. So let's keep it up.
Yeah, I'll echo all that. I know we're running out of time, and just echo the thank you to all of you for the picking up the phone and making calls. It makes a difference. And stories are so important. So share your stories. And we will keep lifting things up as we hear them.
Awesome. Thanks, everyone. So the TJC team will wrap up for today, and we'll see you all next week with some more conversation around your work, our work, and what we can do to make a change. So thank you, everyone, for joining us today, and I hope you have a great rest of your afternoon.